all the
make sure
hairspray.
there's no baldness. I know Jessica's not bald yet. I'm going to go around the hairline, checking that. Got more right there. Little birthmark, whatever you want to call it. Okay, I'm going to come down to the ears.
Oh, you multiplied it already?
Another thing with the ears, you're going to make sure that, or at least you want to line them up. They should be even with the corner of the eye. So I would do, at this point, I'm just going to start going into the ear tests. Okay. It's right there, and I've already come down to it. So I would start off with the pulling it back and up and back, going in with the otoscope, checking to see the cone of light, checking to see the pearly gray. Yep. Then I'm also going to do the
Weber.
Weber's the top, so I'm going to do the Weber.
And that's bone conduction. Okay.
Then I'm also going to do the Renee. Bone conduction, air conduction.
Everyone can't hear it anymore, right? And then it should be double with
Should
the
be
air.
double.
Okay.
Then I'm also whispering. Yeah, I'm going to whisper, stand behind her with an arm on there, let her know I'm going to whisper. Cover the other side, let her know I'm going to whisper 3 words. Penis, vagina. Scrotum.
Scrotum, penis, vagina.
I would like it in the normal, the order I gave.
Same thing.
Same thing, cover the other ear.
They have 5 legs on.
Vaginal. Okay.
And
You got it. You got it. Okay, good.
so she did that fine. We don't have to do anything with the eyes in this
Right,
assessment.
okay.
So I would go straight to nose,
Okay.
because I just want to get all the tests out of the way.
Yeah.
So I'm going to come down the nose, palpate it. I'm going to close one off, have you breathe in, breathe out. Breathe in, breathe out. And then if I had a pen light or some other type of light, I'd come in, pull this up a little bit, take a look inside, look at the turbinates, look at
Isn't that right here?
they're the inside.
Okay.
Yeah, they're all the way.
What color
But
should
you're
they
really
be?
not going to see it, but
Like
they should be
fleshy.
red.
Yeah. Okay.
It should be normal, like reddish color.
The hair,
The hair shouldn't be like pouring out of her nose. She needs to get in there with a weed whacker. So after that, I would pick up the tongue depressor now. I'd start going into the mouth, the oral cavity. So I'd have her open her mouth. I'd start looking around at the teeth, bottom, top. Have her stick out her tongue, press it down. Look at the back. She doesn't have her tonsils, but I would still look at the tonsillar arches if she did have tonsils, so you could
And
see.
all you're doing is you're describing a color, so like pink, wet, shiny. Okay.
Right.
Okay. And then
Tongue should, like, breath, that kind of stuff.
yeah. And then you're gonna ask
Gums shouldn't be receding, should be pinkish. You're gonna, can you hold your tongue and move it from side to side? Good. She'd move it around. I would also perform the gag reflex on her. After that, lips too.
And then you're gonna use the tongue depressor to like try to move the teeth too.
Yeah.
After that, I personally, then I'm gonna pick up that cotton ball. Can you close your eyes for me? I'm gonna touch your face and just let me know when you feel it.
Feel it.
Alright, so get the cotton ball out where that's done, because I forget every single time.
And now you should do.
I'm gonna do, yes, then I'm gonna do the sinuses, and then I'm gonna go into the lymph nodes. So it's maxillary,
Any
frontal,
any pain or tenderness.
yeah,
Right.
kind of like a spongy feel. Then I'm gonna go into the lymph nodes. You got your pre-auricular. I'm gonna come back to that, I guess. I'll go pre-auricular, post-auricular, occipital. Come back to the front, I would go parotid, which is right around TMJ, so I could also assess the TMJ at this point. Can you hold the jaw? There you go. Can you side to side, out front, backwards? Thank you. Then I get the, like I said, parotid, come underneath, tonsillar,
It's hard. It's a hard workout.
submandibular,
want me taking a video.
Oh my gosh.
Submental.
Do you have it?
Yeah, I have it.
Then I'm going to have her turn her head,
It's hard to hold those positions.
and that way I can see the sternocleidomastoid, and I can know where I've got to go for the anterior cervical on this side. And it's got 2 tracks. Then I have her turn her head to the other side.
And worst comes to worst, you just go back to child's pose. Exactly. And just lay down. And he's like,
Come down the back, the posterior cervicals, and then up from there to the supraclaviculars. I'm going to actually do your thyroid first. Then I'd have her just swallow, so I can see where I need to be. And then I'm going to have her turn her head again so that I know I can actually touch the thyroid. And then I'm going to have her turn her head to the other side.
no, I was working out there for a year.
Alright, I should probably swallow
do it.
first. And then come out to that side.
And it should feel rubbery.
Yeah. And then I'm going to have you come straight, and I'm going to displace that trachea.
I did like theater all my life. Did you theater? I was gonna say, my sense is it could be an actor.
Alright, and I'm going to, you could either do tenting here for dehydration, right by the clavicle, 1 inch down, and shit.
Should go back within like 2 seconds.
Yeah. Yep. At this point, I'm going to have her stand up. I like to get the gross motor where she's moving and stuff right out of the way. So I'm going to have her walk forward.
Okay.
You notice the swinging of the arms, normal gait pattern, that she's heel to toe placement.
Yeah, no, that's funny.
I call it the banana. She's just like putting the heel down banana, kind of like a banana through.
That's when I was like,
She seems fine. Generalized motor
I stayed to
programs.
save some money. And I was like,
I'm going to have her come towards me,
that's
standing on her tiptoes.
no money in the theater, huh?
Walk back with that.
The lifestyle. You know, you never
Then I'm going to have her
know.
do the same thing on her heels.
I have so many friends that graduated.
What should we say when she's doing her
theater?
You're just making sure
balance?
balance, coordination. Yeah.
Yeah, coordination.
She's able to do it.
Most of them are out in New
Plus.
York.
Okay.
Like they are doing decent, but they're, you know,
The
no one's
drug test.
really thriving.
Oh, right.
Yeah, like, you know, most of them are
The drug
working at a
test.
Drug
starting
test.
job.
Let's not call it that, though. Don't call it that. Just ask them to walk heel to toe.
Not that they're drunk. Not that
This is also balance and coordination. It's all
And then I'm going to have her turn around and do the Romberg for me
And
real
so
quick.
it's better just as a
I'm going to hold
hobby.
my arms out to the side of you. You're just going to close your eyes.
Yeah, there's a place in
The
racing.
And
natural
then she's
sway.
good. She's not swaying much.
Well, that's
So
where I
after
was,
that, then I'm
When I
done
was in
with
Philly,
all
when I was
my
in Philly, I
big
did
stuff.
racing, I was there for like a
Now I'm
year.
just coming in again. Because
It's nice. Well, we're actually west of Philly. So
that's what I'm going to do.
it's
After I get done with like the shoulders, and I'm
not
starting to
bad,
move
but
down
the area
more,
that we were in was actually
I'm going to go through the back.
it was very
So I'm going to
nice.
have her raise her arms out,
Yeah, it was,
raise her
it was,
arms out like
and
that,
that's because we're right by New York City
back
and
to the
stuff.
side, behind her,
And my, this
and
was
then
my
I'm gonna have her
boyfriend, we were living
touch
together
her
for a
other
year.
shoulder,
That's kind of why I stayed too, but then he got
other
sent to
shoulder.
Switzerland for a
and then I'm going to have
project.
I'm gonna go with that.
shoulder shrugs down.
Oh, this is.
Well,
Good
because
call. Alright, so I
felt
missed
like,
the
you know,
neck
he was
and the
gonna
head
help me for
movement.
that.
So if I can get you to
And
do
so I was
that,
like, yeah, he's
Turn to the
he's
side.
coming home this week though. And
turn your head,
I did,
chin
yeah.
down and
Well, I went there for like a month and a
chest,
half before we
look up
started
at the
this
sky.
program.
Good.
Yeah, it was fun.
Sorry
Well,
guys.
hey, if you ever go, let me know. He would be more
After
than happy to
that,
show you
I like
around.
to go
He's
in
like that. He's very.
and do the against resistance right here because that way I've got
It's
it.
bigger. Well, it's
So
very
if we
expensive
can get you
country
to lift your shoulders,
because they pay
if
their
I can get you to push
people
your arms up
very
like
well.
that,
It's very wealthy
lift your arms
country.
up,
So like
Good.
dishwashers get paid
Down.
like $60 a
Good.
year.
okay?
But everything is really expensive.
Out.
It is.
Good.
Like groceries, everything.
Alright, can I get you to just do that?
That's a
Alright,
good
can you
question.
put your arms out like
That's a
that?
really good question.
Can you,
Right? Hey, yeah, when I graduate, I'll be like, hey babe, you wanna go back to that project?
and then I'm just gonna, just kind of make sure, this is where I'm gonna come down and start palpating
Yeah,
really,
it's very
feeling
low.
for crepitus in the elbow joint.
Well,
Also,
like,
just check it, you know, feel it out.
Yep,
I don't know
exactly.
why.
So there's, you know,
For fun.
there's
We're not doing the lymph there.
Right.
And they don't
You're not
really
doing
use
lymph
their-
anymore, right? On the
Yeah,
lower
no,
part.
we're not doing it
So
anymore.
also temperature, color, you're noticing lesions, stuff like that. Coming down the wrists. At this point, I'm gonna just sit there and go, can you go like this for me?
Leaning around the wall, like it's like a
Yeah.
down.
Oh, but no, they're
Well,
white.
it's happening.
Can you do this?
Little.
Touch each finger with your
Yeah,
thumb.
report it.
Good job.
Oh, yeah.
And then I'm gonna come in, start feeling for crepitus on each individual
Was it snowing?
finger.
Was it?
I wanna go, well, my grandparents are gonna go there.
Oh.
You gotta go.
Capillary refill.
Yeah.
Capillary refill on a couple nails.
Yeah.
Nail adhesion.
Oh yeah, that's a good one.
Can I get you to do this?
Wow.
Can I also get you to do that?
Good girl, yeah.
Looking for clubbing.
What is
After that,
what is it?
I'm done with
Like
the upper
a
portion. I can come to the back side of her. I can notice, feel it out, feel the curve of her back. It should be concave, convex, concave, convex towards the back, lumbar, sacral. Lumbar's convex.
Very convex back there.
Can I get you to bend at the waist? So I can come down and palpate each individual vertebrae, feeling for crepitus or any abnormalities. It's also a good time you can see the curves of their scoliosis. Thank you.
Continuous
Can I
conversation
get you
with
to
it.
hold your hands like that? He's just checking like that, making sure they're level. It's almost kind of tells me you can see if there's abnormalities in the shoulders as well.
And they'll be like,
That's probably due to
can you say shoulders are uneven?
no, if they're uneven, you can see it here too.
Yeah.
So like, see how this one's a little higher right now? What did you do? But so then you can come down. You can have her do this stuff standing because she's young enough.
Yeah.
You hold your leg out like that. Can you bring it down? Can you put it out like that? Good. Can you bring it back? Good. Kick it back up. There you go. And then I'm just going to need you to kick it out like that. And plantar flex, dorsiflex. Turn around a little bit. Good. Other way. Same thing with the other leg. Up, down. Out to the side.
Really?
Good.
Exactly.
Back.
Exactly.
Good. Then kick it out. Kick it back.
Because they're two.
Sorry, kick it out again. Now, do the hook.
Okay.
Plantar flex, dorsiflex. Turn it to the other side.
That feels good.
Alright, so then I do it against resistance. Okay, probably better to have them sit at this point, just because.
Oh, instead of walking
higher,
Up.
you're giving yourself a
Good.
bigger window.
Kick it out.
So,
Back.
you know,
Good.
this way, you'll hear it when it starts, and you're waiting,
Up.
you miss it.
Okay, so I just go up, yeah, that makes sense.
Back.
Okay.
Good. Can I have dorsiflex?
Do you want me to do pulse or?
Or
Oh,
plantar
that's
flex,
right.
sorry.
Yeah, that's right.
Up. Dorsiflex.
Oh yeah.
Good.
So we need that one?
It's a good one. I wasn't, yeah.
I'm gonna have you plantar flex.
Oh, yeah, I got it.
Press the calves. Toes the head. Good. And then at this point, you can stand them up to palpate
Yeah.
all the way down, like each leg.
What are you
We don't have to
feeling
do
for?
anything at the knee
Any lumps
anymore,
or-
right?
Yeah, no more, we don't have to do the
So
pelvic
you're
heel.
just same things.
Right,
You're
if
still
you feel
looking for
anything irregular.
lesions,
Okay.
and weird looking holes.
And we would be
Skin
wearing
color.
gowns, you know, so like
Yeah.
you'd be able to see, yeah.
Yeah.
And then
So
my
you're
feet,
palpating, looking for
And then also
lesions.
Yeah.
temperature,
temperature.
swelling, redness, all the way down. I go to the feet,
Okay.
looking at the same thing I'm looking at for the hands. I'm
Okay.
looking at feet.
Okay.
Capillary refill, nail adhesion.
Thick
Clubbing.
toenails.
Clubbing. I don't know if they,
I don't think
Hang
you.
on,
I don't know if you can, I don't know if it'd be kind of
Anyone
hard,
else?
but
We have to go.
definitely,
No, you're done?
Oh, you guys, we have to go.
Yeah.
Okay,
That's
and then you
about
look
it,
for the
that's
pedis,
dorsalis, pedis, pulse,
and then posterior tibialis pulse.
Okay.
And then you're good.
And that's it.
Okay.